What are your, say, top 3 to 5 reasons that you use exosomes?
Yeah, saving people from having joint replacements for degenerated joints or what we call osteoarthritic or osteoarthritis or bone on bone joints. That's my low hanging fruit. We have fantastic results generally. I can show examples of that. We're allowed to do that. I can't make any claims, but I can show you examples where we have injected and over the months after that's shown increase in the thickness of the cartilage in the knee, for example, although we do many other joints. So that's probably number one. It's what being a spine and sort of musculoskeletal doctor of sorts, that's my low hanging fruit anyway. I see those kinds of patients. So we do spine, we do joints, that kind of thing. So if you have painful arthritic degeneration and it's slowing you down and you're not able to exercise and you're not able to have your quality of life, this is something worth looking into. I think the second most popular thing is IV, either wellness, which is a preventative or a slowing down the biological aging process of the cells, or we do it for people with autoimmune and hyperinflamed problems like Lyme's disease, long COVID, different arthritis conditions throughout the body, thyroiditis, MS, anything with an inflammatory component. The exosomes will help suppress the inflammation because sometimes the disease is one thing, but the inflammation caused by the disease is a bigger problem. So sometimes just suppressing the inflammation is more than enough and a lot better than some of the drugs on the market that have side effects, since exosomes have no lasting side effects that we've seen.
Good point. And they're non-immunogenic, meaning they don't invoke
Right.
an immune response.
Correct.
So have you seen in your practice some significant benefit for, say, long COVID?
Yeah, no, we do that in two different ways. So sometimes it's IV, and sometimes people have the lingering chronic bronchitis and cough. We will do a breathing treatment. So like a good old fashioned asthma breathing treatment for 30 minutes. We'll put the exosomes in saline and let them breathe them in. And then we have a handful of patients with interrupted smell and taste that we will do a nasal spray of the exosomes because they get back to the nerves and the neural tracts that go up from the nose to the part of the brain that deals with smell. So we have some